third and final exercise that I'm going to demonstrate for my client, Susie Q, is going to be the forward standing lunge with the use of 4-pound ankle weights. I chose the standing lunge because it's challenging and it's not just a perfect exercise for the lower body, but it also gives you a really good core exercise. It's also really great to incorporate balance and stability, as at some point in the exercise the client will be on like one foot. The forward standing lunge is a multi-joint exercise, and it is also a closed chain movement. The primary movers are going to be the gluteus maximus, the hamstring group, the whole hamstring group, and all of the quadricep group. The stabilizers are going to be the gluteus minimus, the gluteus medius, the erector spinae, deep lateral rotators, and the gastrocnemius, and also the erector spinae. So the movement goes like this. It has 3 phases, just like all of them, the beginning, central, and terminal phases. The beginning phase is going to begin with the client standing with their feet, I guess about shoulder width apart, with their hands on their hips, making sure that they're looking straight ahead and that they're using their 4 points of posture, which is really good for this exercise. When you use your 4 points of posture, you know you're going to be in good alignment. Okay. So you're going to begin with your front foot. You're going to step out, and you want to bring your body down in a straight line. You want to make sure that your foot is far enough away that the heel on your back foot is going to raise up, and you know it has to raise up. If it doesn't, you're going to have very bad form. Raise that foot up, and then this is going to be the concentric phase. This is where your quadricep is going to be shortened. The movement continues with the client moving downward. You're going to let them move down until the knee pretty much almost touches the ground. Okay, that's going to be again part of the central phase of the movement. The terminal phase begins when the client pushes off with their front working leg to return to the standing position. That is going to be the terminal phase of the exercise, and also the eccentric phase of the exercise of the working leg. 2 things that may happen with your clients is that when they do the movement, they may tend to put their knee over their toe, which, as you can see, will throw you off balance, especially with these ankle weights on. It can throw you off balance, and it's really hard to recover from that as opposed to that. A second thing that the client might do incorrectly that you might want to correct, that you will want to correct pretty quickly, is if when they're about to do the terminal phase and they're bending their back, and it might seem like to them it will be a little bit easier just to throw themselves back. But they don't want to do this because you always want to keep your lines neutral, especially with your spine. Anything involving your back, you want to keep it nice and straight. That's why I said using the 4 points of posture in this exercise is really good. One biomechanical consideration for this exercise is if your client has ever had like a knee injury or a knee surgery or anything of that nature, arthritis maybe, might not be the best exercise for them right off the bat. Now we are going to do the points of evaluation, and I'll just keep the ankle weights on, and I'll let my assistant do it without the ankle weights. So the primary movers, like I said, are going to be the gluteus maximus, and the hamstring group, which is the back of the leg. Also is going to be the quadriceps, which is the front of the leg. The biggest medius part of the leg, very strong muscle there. Also, what's going to come into play is the gastrocnemius, otherwise known as the calf muscle, the, what else? The deep lateral rotators, which is inside there. Also, what else? Okay, that's it for the primary movers. Okay, so we're going to start with the movement. We're going to start with the beginning phase, and client is in position. Make sure that his joints are all aligned. When they are, he's sitting up really nice and tall. We like that. And so he's going to go ahead and do the first part of the movement. Okay? Want to make sure that his joints are going to be nice and lined up. This wants to be a 90-degree angle, or as close to it as we can get. Come back up. I want you to move this foot back a little bit. And then take a little bit of a wider stance when you do that one. Very good. Now that's perfect. We want to make sure that that back stays nice and aligned, and we want to make sure that his muscles are in balance. When I palpate the muscles of his hamstring, everything feels like it's nice and lined up. Go ahead and come up. Now go ahead and do a couple of them. Good. One. Breathe. Don't forget to breathe when you go down. Good. I want to make sure that when he's doing this movement, he's doing it and he's not struggling, and I want to make sure his tempo is good. He's doing it slow and controlled and concise. I want to make sure that his line of motion is precise. I want to make sure when he goes down, he's stepping down pretty much at the same spot every time with both legs when they alternate legs. I also want to make sure of the integrity of his joint range of motion. This is going to play a pivotal role, especially in the knee joint and in the hip joint. If a person has had previous knee injuries, then that range of motion for the knee is not going to be good. They're not going to be able to come close to a 90-degree angle on their knee. And if they're struggling and having problems, then you can let them stop, of course. His transition phases from from all three phases is fine. There's nothing herky-jerky about it. It's perfectly in tempo. His alignment and posture is working very well. He's incorporating his 4 points of posture, right? He knows them. And everything is lined up perfectly. And then, last but not least, I palpated his leg earlier. I'm going to go to the other side and palpate the other leg. One more. And make sure that his muscles are in balance. All of the muscles feel like they're nice and in balance. And very good. Very good. So those are the points of evaluation for the forward standing lunge. The client is able to perform it exactly the way it is intended to be performed, and he is ready to move on to the next level. So after Suzy-Q has been working out with me for a little while with her resistance training, there are a couple of exercises that I want to incorporate for her because she's going to be stronger and she's going to be looking for more of a challenge. And these two exercises are going to give her a bigger challenge. We're going to do the forward standing lunge with the 4-pound ankle weight. We're also going to add a press with it. And that move will look like this. The starting phase. Okay. So that will give her, not only will it work on her balance and stability, but she'll be able to work her shoulders and her chest and biceps at the same time. So we're doing kind of like 2 exercises in one. The next one that I will have her do, after she gets used to all those push-ups and she has good form on her push-ups and she's able to do at least 20 of them standard push-ups on her own, I'm going to introduce her to the incline push-up. And this is like a standard push-up, but we're going to add a little twist to it. We're going to let her put her feet up on this incline box, which is, I hope it doesn't move. we're going to have her put her feet up on the incline box and do the push-up that way. So it will look like this. So that is the incline push-up. So it has all the benefits of a regular standard push-up, but raising your feet up in the air makes you take on a little bit more of the body of your body weight. So it is kind of like twice the exercise. And that is going to conclude my exercises for Susie Q. She will be a lean, mean fight machine when I get done with her. And thank you.